my name is Rachel and I'm going to be performing my head-to-toe assessment on my patient today. So first off, I'm just going to have you tell me your name, date of birth,
Susan DeMayo, 10/25/55.
and where are you?
In Vernon, Connecticut.
Okay, and who's the president?
Trump.
Okay, great. And what day of the week is it today?
Saturday.
Okay, perfect. So she's alert and oriented times 4. She looks like she's in no acute distress. First, I'm going to examine just your head to start. I'm just going to look at your scalp hair distribution, make sure there's no abnormalities, lesions, alopecia, no ticks or anything like that. Okay, perfect. Head looks good. Next, I'm going to examine your eyes. I'm gonna have you take your glasses off. Perfect. I'm going to lift your eyelids up, check the eyelids, check the sclera. Sclera looks nice and white. Conjunctiva looks pink and moist, no abnormalities there. Eyelashes are full, eyebrows look good as well. I'm going to look at your lips. Lips look good, moist and pink, no dryness, nothing like that, lesions, anything like that. Nose, I'm going to inspect your nose. Nose looks good. Midline, I'm going to have you check for patency, so I'm going to have you plug one nose and breathe in. Good, and the other side. I'm just going to check your nose, look up with my pen light here. Those look good, moist. And then everything looks good, septum, midline. I'm going to check your ears. I'm going to use take a look inside, look at the tympanic membrane. It looks pearly and gray and white. The ear looks good, no lesions, abnormalities, normal shape. Any hearing difficulty at all?
A little bit on this side.
Okay. And check the other ear. We'll check your hearing as well. The tympanic membrane looks pearly gray and white, no lesions, everything looks pretty normal there. Okay, good. Next I'm going to check your eyes again. So we're going to do the cardinal field test. So I'm going to check, you just follow my finger with your eyes and try not to move your head. Good, perfect. Perfect. I'm going to check your pupil. Cover one eye and check your light, the reaction to light, equal, round, and reactive to light there. I'm going to check your other eye, cover it. Pupils are about 3 millimeters and round, reactive, good. Next, I'm going to I'm going to use my ophthalmoscope and check for, look at your retina. And I'm going to check the optic disc as well. That looks good. That looks all normal to me as well. So next we'll do a hearing test. So what I'm going to do, it's called the Weber test. So I'm going to strike if I had a proper tuning fork, I'd use it, but I would strike the tuning fork, I'd place it right at the top of the head, and I would ask you, where would you hear if the hearing was both normal on both sides? Is it midline? And normally it would be yes, so that would be a normal finding. The other test I do would be a Ryan test, so I would hit my tuning fork, and I would put it behind the mastoid right here, and then I put it up in front of the ear right here. Normal finding would be it would hear the sound better in front of the ear, and that would be a normal finding. Next, I'm going to check your accessory muscle. I'm going to have you just bring your shoulders up towards me while I press down. Perfect. I'm going to check the neck. It looks midline, no abnormalities, good. I'm going to check your range of motion in your neck, just left to right, move your head left to right, and then front, flex and extend the neck. Okay, good. I'm going to check the thyroid, so I'm going to stand behind you. I'm going to have you just bend your neck down towards your neck and then swallow for me while I check the thyroid. Perfect. I don't feel any lumps, lesions, abnormalities, any tenderness, anything that feels normal. Is there any pain while you swallow there?
No.
Okay, good. Next, I'm going to inspect your mouth. I'm going to have you open your mouth for me. I'm going to use my pen light. I'm just going to check the tonsils. Teeth look intact, moist, pink color in their tongue. Can you stick out your tongue for me? Good. And can you lift it up? Lift your tongue up. And then I'm going to just have it move it left to right. Check for any lesions, abnormalities. That looks good. No Everything looks normal. Can you just gag say ah for me? Check your reflex there, uvula, perfect. Okay, that looks good. Any issue swallowing or anything in there?
No.
Okay, good. So next I'm going to just assess your lymph nodes. So here I'm going to do your preauricular, postauricular, your occipital, tonsillar, submandibular, submental here, your supraclavicular lymph nodes here, superficial cervical, and your deep cervical back behind here. And there's no tenderness, any tenderness that you can feel when I palpate? No. Everything looks pretty normal to me. Okay, good. So next, I'm going to grab my stethoscope. I'm going to just first I'm just going to check some pulses here. I'm going to look at your I'm going to look at your breathing. Looks like you're no acute distress. Your rate is normal, good rate, rhythm, breathing comfortably. Any pain anywhere?
No.
Okay, so I'm gonna just check your radial pulse here and just listen or feel for 15 seconds. That looks like a regular rhythm. I'm going to check your carotid pulses here one at a time. That's good. And I'm also going to check for bruit with my stethoscope here. Okay. No bruit is present. That sounds good. Next, I'm going to inspect the chest. Looks like the chest is normal. No abnormalities that I can see. I'm going to stand behind you. I'm just going to check for symmetry. I'm going to just put my hands behind your back here and just have you breathe in. And this looks like symmetrical expansion on the lungs. That looks good, normal. Okay. I'm going to have you scoot forward just a little bit as I get you in the camera here. I'm just going to scoot my patient forward so we can get her in the camera. Perfect. I'm going to do some percussing on the back. Check for resonance. All here. And that should be resonant, which is a normal finding, and that looks good. It sounds good. I'm going to check for tactile fremitus. I'm going to have you say 99 for me, and I'm going to check for that.
99, 99, 99.
Perfect, that sounds good. And say it one more time.
99, 99, 99.
Okay, and that's normal. Good. I'm going to check and listen for lung sounds next. I'm going to have you take a deep breath in, a couple of deep breaths. I'll check all the lobes here when I have her deep breathing in and out. Good, excellent. That's all normal, clear lung sounds, no adventitious lung sounds that I can hear. Next, while I'm back here, I'm going to check for any kidney issues. I'm going to just palpate for the 12th rib and find the spine, the costovertebral angle, and I'm going to just do that right here. And then I'm just checking for any kidney infection, any inflammation that might be present, any pain when I did that?
No.
Okay, great. Next, I'm going to listen to the heart. I'm going to listen in the aortic area here. Check pulmonic, herbs right here, tricuspid, and then the mitral valve here. I'm going to listen for both on using my bell and then the other side of my stethoscope to listen for any murmurs with the bell. And I don't see any, I don't hear any abnormalities. Sounds good, no murmurs, rubs, scallops, or anything like that. So that's good. Next, I'm going to just check your trigeminal. I'm going to move backward and I'm going to check for any sensation on your face. So I'm going to have you just smile, frown, and then raise your eyebrows. Perfect. And I'm just going to check for close your eyes and tell me if this is like a sharp feeling or a soft feeling on the face. Soft or sharp?
Soft. Soft.
Good. This is going to be
Sharp.
good.
Sharp.
Okay, good. Okay, great. Perfect. I didn't assess I just want to assess your jaw here, so can you open and close your mouth for me? Good. I'm assessing the TMJ right here, and that's normal. No pain when you do that?
No.
Okay, great. Next I'm going to have you, I'm going to do the abdomen now. So I'm going to relocate my patient over to a lying position here. So yeah, just kind of move over there. And we'll kind of move.
There's somebody
Just
in
hang
there.
with us 1 second while I get my patient ready for my next assessment here. Okay, so I'm going to assess the, pardon me. I'm just going to have you lift your sweater up while I take a look at your abdomen. First, I'm just going to inspect, check for any lesions. Oh my gosh, get my dog out of here. Any lesions, lumps, anything abnormal here. Everything looks good. I don't see anything abnormal. So next, I'm going to percuss again with my hands. And it should be resonant and dull when I palpate over the liver here. And you can see when it's dull versus resonant, and that's where you can find the liver. I would check for the spleen. I'm gonna have you take a deep breath in. Palpate the spleen. I can't palpate the spleen, and that's a normal finding. Next, I'm going to palpate the abdomen with a light touch here with all 4 quadrants, and then after that, I would percuss or palpate with a deep touch here, checking for any lumps, masses, anything abnormal. I don't see any scars. It looks pretty good. So at this point, I would listen with my stethoscope in all 4 quadrants, check for bowel sounds, and I would see that there's normal bowel sounds in all 4 quadrants there. Next, I'm going to have you look towards me. I'm going to check for any JVD right here. That looks normal. Let's see, I'm going to check pulses again. I would check the femoral pulses down here. I would check the popliteal pulse behind the knee. And I would also check the dorsalis pedis pulses on the top of the foot. Perfect, right. Dorsalis pedis on top of the foot. Posterior tibial pulse out here. And next I'm going to do some range of motion testing. So I'm going to have you arms out straight and flex your arms in, checking the elbows for range of motion, and bend backwards. Perfect. And pull your arms up, and yep, good strength, 5 out of 5 strength. Range of motion on the wrists. Good. I'm going to have you flex the fingers forward, down there, and back. Good. Finger touches, thumb to finger each in each hand. Perfect. A neuro assessment I will do is have your finger to nose test. Yep, finger to nose. Perfect. That looks good. I'm going to assess the palmar. Can you do this? Palms up 10 times fast. Good, that's good. I'm going to put your arms out like this. I'm going to just assess for any arm drift with your arms out straight. I don't see any arm drift, would just suggest like a lesion, and a neuromuscular lesion somewhere. Okay, good. Let me just make sure I'm not missing anything. I saw when she walked in today, she had a normal gait, balance was good coordination. I'm gonna have you assess your knees. Bring your knees up and while I press on your hands or your legs here. Good, perfect. And I think that concludes my assessment. Thank you.